How to remove a tick. Everyone seems to have their own trick for removing a tick. Contrary to popular belief, holding a match to the tick, suffocating it with petroleum jelly, or poisoning it with nail polish only makes it burrow in more deeply. The correct solution is also the easiest: simply pull it off your skin. Learn the proper techniques for tick removal in this informative video. We'll explore step-by-step instructions and safe methods for removing ticks from your skin or pets. Discover essential tips and tools needed for effective and proper tick removal to reduce the risk of tick-borne illnesses. Don't miss this comprehensive guide to tick removal. What happens if you don't remove a tick? Some species of ticks in certain parts of the country can transmit illnesses like Lyme disease, Rocky Mountain spotted fever, RMSF, and Southern Tick-Associated Rash Illness, STARI, the CDC states. While not every tick carries pathogens, waiting too long to remove a tick can increase the likelihood of transmission. In general, it takes anywhere from a day and a half to 2 days or so for a tick that's attached to you to transmit any pathogens it may have, Dr. Kimsey says. Once that tick attaches to you, that sets a timer and you're best off getting it off just as quickly as you can. Welcome to The Guardian's Choice. This video will tell you how to using a pair of tweezers, using a piece of floss, using a credit card, and following up. So keep watching, get your solution, and enjoy. Method 1. Using a pair of tweezers. Number 1. Find the head of the tick. If you look closely, you'll see its mouth attached to the skin, with the body resting behind it. Number 2. Grasp the tick as close to the skin as possible with a pair of tweezers. Use tweezers with fine tips, rather than blunt ones, to make sure you are able to grasp the tick tightly. Don't try this with your fingers. You won't be able to get a good, tight grip on the tick. Make sure you're gripping the tick's head. Get the tweezers as close to the mouth of the tick as possible. Do not grasp the tick's body. This will cause it to inject saliva or blood into your skin and increase the chances of transmitting a disease. Number 3. Pull firmly and steadily outward. The tick's mouth will release the skin. Do not twist, jerk, or wiggle the tweezers as you pull, or the tick's mouth parts will remain attached to the skin. It's not uncommon for the skin to also pull up as the tick detaches, much like it does when you pluck a stray hair. If the mouth parts remain attached, attempt to remove them with the tweezers. If they're buried in the skin, you can simply let the skin heal, checking it from time to time to make sure it doesn't become infected. Number 4. Wash with warm water and soap. You can also use rubbing alcohol, hydrogen peroxide, or iodine. Clean both the bite and your hands thoroughly. Number 5. See a doctor if you have trouble removing the tick. Some ticks are so small that they're difficult to remove using this common method. A doctor will be able to remove the tick for you. Did this video help you? Let's comment below, yes or no. Method 2. Using a piece of floss. Number 1. Cut a length of floss. Choose a thin, unwaxed floss, or another type of thin string. This does the trick if you don't have tweezers on hand. Number 2. Loop the string around the tick's head. The string should lie as close to the skin as possible. Then tighten the loop around the head. Use both hands to pull the floss taut. Number 3. Pull the ends of the string upward. Pull the ends of the string upward in a slow, steady motion. The tick's mouth will release the skin. Number 4. Wash with warm water and soap. Clean both the bite and your hands. Rubbing alcohol, hydrogen peroxide, or iodine can also be used to help prevent infection and the spreading of tick-borne disease. Did this video help you? Let's comment below, yes or no. Method 3. Using a credit card. Number 1. Cut a V-shape into the card. Using a pair of scissors, cut a small V-shape along the edge of the card. It should be large enough to grab the tick, but not so large that the tick can slip through. Number 2. Slide a credit card next to the tick's head. Slide the credit card between your skin and the tick, aligning the V-cut with the tick's head. Number 3. Firmly hold the back of the tick in place. Slide the credit card along your skin and under the head. After a few tries, the tick should come out whole. Did this video help you? Let's comment below, yes or no. Method 4. Following up. Number 1. Dispose of the tick properly. The tick will probably still be alive when you remove it. You can soak it in rubbing alcohol or flush it down the toilet to prevent it from attaching itself to you or your loved ones. Number 2. Consider saving the tick for testing. If ticks in your area are known to frequently carry Lyme disease, you might want to save the tick in case you need to get it tested. Place it in a plastic food storage bag, seal the bag, then put it in the freezer. Find a lab that does tick testing and follow instructions for properly submitting the tick. Number 3. Check the wound site for symptoms. In the weeks following the tick removal, check the site for signs that you may have contracted Lyme disease or another tick-borne illness. You'll need to tell your doctor when you noticed the tick, when you removed it, and what subsequent symptoms you notice. If you notice the following symptoms developing, see a doctor immediately. A fever and/or chills. This is a common symptom of tick-borne illnesses. Headaches and muscle aches. The telltale bullseye rash. This is a symptom of Lyme disease as well as southern tick-associated rash illness, starry. Red patches create a bullseye pattern around the site of the tick bite, so watch out for this. Any other type of rash. Rocky Mountain spotted fever, RMSF, also carried by ticks, can cause a rash that does not look like a bullseye to appear. Did this video help you? Let's comment below, yes or no. What if the tick's head remains in the skin after removal? If it looks like part of the head or mouth has been left in your skin, don't freak out. Sometimes the tick's mouth parts can be left behind in the skin after a clumsy tick removal, says 𝒄𝒏𝒏𝒄𝒓𝒊𝒃𝒆. Treat this like a splinter, it can be forced or dug out or left to work its way out. There is no real risk from tick mouthparts themselves. When to call a doctor after removing a tick? There are some situations where, even after removing a tick, you need to seek attention from a medical professional. Be ready to call a doctor if 1. A tick has been on a person for more than 24 hours. 2. The tick bite appears infected, oozing green or white discharge, or feels warm to the touch. 3. A rash develops on your body after the tick bite. 4. Symptoms like joint pain, fever, or muscle stiffness develop in the days after a tick bite. Tips. 1. If you are bitten, write down the date. It is possible to catch Lyme disease without noticing it right away. In some cases, symptoms emerge up to a year after the bite. If you write down the date, a doctor can take this into account when diagnosing you, as Lyme disease can become chronic after a period of time. You should also be aware of ongoing symptoms that persist even after a first round of treatment, since you may be experiencing post-Lyme disease syndrome. 2. Removing a tick shortly after being bitten greatly reduces the chance of disease transmission. It is unlikely that you will contract Lyme disease if the tick has been attached to you for less than 36 to 48 hours. 3. Have someone help you if you can't remove it or if you are nervous. 4. Many outdoor apparel companies sell tick removal tools. Place the hole around the tick and press down and slowly drag it under the mouth until it releases. 5. Keep your lawn trimmed short to prevent ticks. They like shaded areas. 6. Take a shower after going through large areas of shady grass, in case you aren't sure if you have any. Then, examine yourself, your family, and your pets. 7. If you have a tick on your skin, get it off as quick as you can. 8. Check for swelling of the bite after the tick has been removed. If the area becomes inflamed, see a doctor. Warnings. 1. Do not attempt to suffocate the tick with petroleum jelly. This makes the tick hold on to your skin more tightly. 2. Do not try to remove a tick by holding a match to it. This causes the tick to burrow more deeply into your skin. 3. Do not try to pull it off with your hands. It might leave the head embedded in your skin, which can lead to infection. Did this video help you? Let's comment below, yes or no.